Great. So great to be back at the AI Week. It's been last year. My name is Yossi Matias, and I'm leading the global health AI team at Google, among other things. And great to be here again. So last year we talked about AI for social good, and actually gave heads up about our partnership with Tel Aviv University. Very pleased to see the progress since then, and thanks Deborah for leading many of these activities that we have in collaboration. And also in general, the area of AI for social good is we see great progress across the board. For example, I mentioned about our initiative to use machine learning and cloud for flood forecasting. Just in the last monsoon season, we sent over 115 million notifications to people at risk, alerting them of floods coming their way. And there are many more updates that we could provide. But today we're going to focus on how AI can help in a health domain, which I think is one of the most exciting opportunities that we see ahead of us in general. So when we think about advancements in AI that enabled progress, just to highlight a few of the reasons why this is becoming increasingly more impactful. The progress that we see in advances in AI, we can think about first, of course, the deep learning, which revolutionizes machine learning and AI in so many fields. And we've seen some deep learning maturation about how to be able to do that, and we're hearing a lot of that in this conference. Second, of course, the computing power that we see increasing and enable today things that were not attainable in the past. And last but not least is really the availability of large labeled open source data sets, which obviously is a requirement for a lot of what we need to do in machine learning, and the ability of a community at large in the health systems, in academics, in research, to enable such open data sets is really changing, making a huge change in the field. And of course, there are many other advances that can be discussed. Now we're talking about the healthcare system. Obviously, the opportunity is enormous. You think about the economic, the impact on people's life. There's estimated over $3.6 trillion spent just in the US. A lot of the spent is considered as something that is could be preventable. There are many thousands of deaths that are assumed to be preventable if we could actually have a better, earlier diagnostics, have a more efficient health care system, etc. And also on the health givers, the heroes that are actually kind of dealing with healthcare systems. We hear a lot about burnout, about shortage, and then of course the opportunity is how can we use technology in general, how can we use AI and other ways to help out that system. So I'm going to talk about 6 areas, very briefly, about 6 areas where we think AI can really be helpful here. Starting with how to help people find information and navigate through their needs, going to how to help the clinicians to giving decision maker, how to help the public health sectors with better decision making by providing data that can actually be helpful and have impact on the society at large and on people individually. How to see the revolution of the sensory data with our devices, which can open up new opportunities for well-being in healthcare. How to help caregivers. As I mentioned, there's a burnout there, and there's opportunity here for us to help out and to make the entire system more efficient with technology. How to support scientific advances. There are exciting opportunities out there, and already some great progress in several fields. And last but not least, how to help caregivers in the basic procedures and processes, anything from diagnostics, in both the accuracy, availability, and the workflow of that. Now, I should mention the opportunities are amazing, and it's great to see many companies investing in that. It's great to see the ecosystem, the startups that are working on many of these areas, and we're happy also to collaborate and work with both our research and startups on these domains. Now at Google, we are putting a lot of emphasis on the health domain. In fact, across our products, since many people are coming to Google to search for information about health, we have the opportunity to use technology in addressing it through all the platforms that we have, anything from search to YouTube to cloud supporting businesses doing that, to devices such as Fitbit that is now part of Google, or just the Nest devices that are on people's homes. We have the opportunity to transform to have a solution for changing delivery of things. And in the research organization, we are looking into how to advance AI, both in the fundamental ways, in the publications, in the peer-reviewed publications that actually can advance the field, as well as partnering with institutions and looking into how can we improve on the accuracy and availability of technologies to people worldwide. And again, typically we are looking to see how can we develop solutions that can actually help billions of people and be life-changing. And also how to use our data for the public data. So we're looking into how to help the consumers, the caregivers, the community health, and to do that in partnership with the ecosystem, with the academics, with the health organizations, etc. So I'll try to touch at least briefly on the various areas that I mentioned earlier. Let me start with how to help people find information and navigate and in their everyday needs. So it may not be surprising, but when people care about health, they do what they do on finding information. They come to Google to search. This is an example for the search queries for COVID that we've seen during the peak time of just almost 2 years ago now. We've seen the number of searches related to COVID was 5 times more than anything you could imagine, news or your favorite search queries out there. And similarly, whenever we started with vaccinations, people were looking for information about that. So one of the opportunities, of course, to help the health ecosystem is simply through our platforms. This can go to providing the search information about COVID. Actually, many people are doing that to date. I'm doing it on a daily basis, looking for anything from symptoms to starts, etc. And much of this work, by the way, is done by teams in Israel. Similarly, YouTube is a platform where people find information, authoritative information, helpful information, how to remain safe. We've seen over 500 billion views of related things. Now, this is about COVID, but obviously this is true for many search queries. Actually, a good fraction of search queries every day is related to health, and people are looking for information about health. So we're going to look into how to help people with these in various ways, and I'll mention how to connect also some of the disciplines into this kind of platform. But there are many ways in which we can actually help on this domain. Let me jump to the second category, which is about how to help decision makers get the better data. So again, if I consider the situation currently with COVID, one of the important information that decision makers has to take, such as governments or cities, etc., is to understand what's going on from a public health perspective. So for example, it turns out that just understand how people are moving around in the city, which has impact about infections and others, is quite important to actually take decisions in the country level. And what turns out that by taking aggregated data, which is anonymized and enables showing the traffic, the mobility, what is called the mobility of people around the cities, how many are going to the parks versus on the streets versus restaurants, etc., became quite important for some of these decision making along the line. And this is one example. Similarly, when vaccination started out, it turned out that in order to be effective, one needs to understand the needs for vaccination and also, on the other hand, to make this information available to the public. Now, one should understand that once we make these systems more efficient, we can actually help many more people. So this has direct impact on people's health, and by being more effective on these, there are great opportunities. And again, these are just a few of those. A few years ago, we had collaboration with the World Bank and the UN about food security, which enabled to actually address some public planning so as to impact humanitarian and avoid and prevent humanitarian crisis. So these are just a couple examples of how we could use data for that. But when we think about public health, actually, there's also a fundamental question of how do we leverage when we think about what's going on in the health ecosystem. We know that the system typically is not efficient in many countries around the world. Actually, probably there's a headroom everywhere. But it turns out that caregivers, quite often when they see patients, they don't have the background information, they don't have access to that, which I'm sure many here can relate to in their own experience, even in the best and advanced hospitals. Not everything is available all the time for everyone. So there's a great opportunity to see how can we help and make this connection. How can we provide data that is going to be available for caregivers just in time? So just to highlight one such attempt, which is some work we're doing in India, is to try and standardize and provide interoperability layer, and by providing healthcare workers with access to patients' record, and so they can actually get information in time and also update things in an efficient way. So both improve the experience of the healthcare givers, as well as to avoid mistakes, to be able to provide a better kind of solution. And one approach taken here is to use the so-called FHIR standard with a software development kit development, enabling also third-party developers to develop their own platforms and applications so that we can have a common health stack, an open health stack that enable authorities to provide the information there and allow third-party developers to develop their own solutions so that it can be incorporated. So again, there's a lot of way to go in this direction, but I think this is one of the more important ones, because it doesn't matter how good our technologies are or how good the data that we have, if in real time when a patient sees a caregiver, they actually don't have all the right information in front of them. So this is one approach that is quite important for that. Let me jump to the third category, which is about sensors. And here again, we're seeing, I would say, we're just in the beginning of a revolution in terms of what can be done and the power that is given to individuals in their own on their own wrists or palm, depending. You can think about a phone, you can think about a watch, smartwatches, etc. So here are a couple examples. One is about sleep sensing. Turns out that today, just with the sensory that we have on the on devices that we carry with us, we can actually have a pretty accurate understanding of the signals of sleep. And this is already kind of, some of you may already experienced it. This can be shown on your mobile, give you pretty accurate information that is important for both well-being as well as for giving some information that can be relevant to the health situations and conditions. Or the opportunity to use the phone sensors to get information about your heart rate and respiratory rate. Again, this is the kind of stuff that typically just not long ago you had to go to a doctor's office, and probably in the last few years you could buy devices that could do it for you. But what we see now is that all these sensory information can actually now be available to everybody in their phone or on their watch, and of course this opens up many opportunities to help out people on a regular basis and provide kind of an early indication so that people can take action and decide if they need to see a doctor, if they need to take any action. So it can have implications anything from wellness to cardiovascular to respiratory to gastro or to neuro-related stuff. And again, I think we're just at the beginning of this kind of progress. And again, once we have those signals in place, there's a lot of room for using AI, machine learning techniques to do a lot of this analysis actually on device. So you can actually preserve total privacy of people by letting them have their own devices, measuring their own signals, comparing them to other stuff, and then giving them some information so that they can take decision. And with the power of the edge computing that we see today, what sometimes people call AI on the edge, we are in a position to actually provide this power in a very at large scale for everybody in their own kind of domain. So again, this is another area that I think we're going to see great progress, because computing power is becoming more powerful, and with the combination of computing power and our better techniques to actually analyze those signals, and there are great opportunities there. Let me jump to the fourth category, which is about help caregivers provide more efficient patient care. Now, this is a famous cartoon, famous or infamous, depending how you'd like to see that, which taken by a girl describing her experience visiting the doctor's office. And the concerning part, of course, is to see that the girl is really interacting with her family, but the doctor is portrayed as sitting in front of the computer. And unfortunately, this is a good reflection of reality. Physicians in clinical visits, they spend good chunk of their time actually dealing with electronic records, with reporting. And the question is, can we use technology to help on that? And there are many opportunities ahead. So just to highlight one effort that we're doing is to see how can we help out, be more effective on having these reports. How can we use the smartness of technology to help out doctors be much more efficient, reduce errors, and make their experience better, so that they can actually divert more attention, more time to the patients. And I think there are great opportunities out there, and this is a very, I think, important area to watch, both in terms of how to provide this information that can later be helpful, but also how to use, for example, dictations and other technologies. So these are all attempts that are out there for quite some time, but now we're in a position to use technology to accelerate these and make it much more efficient. Now, another area is about supporting scientific advancements, and what we see today is an acceleration of what we can do with AI. So one thing to call out is an effort on genomics, and you'll hear today also Andrew Carroll giving a full talk just about that. But I think it's one of the examples where we use AI to actually transform a field, which is to take genomics and to take sequences and try to get information accurately and quickly in a way that is unprecedented. So there are exciting techniques such as deep variant and deep consensus. And just recently, there was this very moving article put out by Stanford about how the Stanford Hospital working with some of these researchers, where there was actually a world record of diagnostics of genomics in just hours, which saved the kid's life. And again, this is an example for much more impact that we could anticipate into the future. And last but not least, there's tons of work done on diagnostics and imaging. So again, very briefly, just to mention a few, radiotherapy is one area where obviously it's one of the most significant treatment for cancer. And it turns out that with AI, we could actually make this treatment more accurate, more efficient. And again, this is an amazing opportunity that we have here. Calling out another recent advancements, which about skincare, a lot of the search that we see today at Google is people asking for information about skin conditions. And what we recently shared is that we are able today with a camera of the smartphone be able to identify and provide information about over 200 skin conditions in a way that people can get information. This is not replacing diagnostics, but it can help people to actually get information so that they can take better decisions about what to do. So rather than the ability for everybody to just use their smartphone and get some helpful information is something that I think the prospects of that are pretty significant. This is true for many other conditions, and this is one area that we're really looking into quite a bit. Mammography is another great example where it's not only about getting things more accurate. One thing that we learned is that typically when women are doing mammography, which is obviously important for everyone to do, quite often the procedure is for a good fraction of the cases to go for a second mammography. Now with AI, we are able to accelerate the time for diagnosis and sometimes perhaps even notify in real time that a second one is required, which I think can both improve the experience for those who otherwise need to wait for a lot of time, or otherwise would or expedite the second screening for those that are prioritized. So this is an example where AI can help prioritize those second screening as related. There's a very exciting area about an important area about diabetic retinopathy, and we're going to hear Nama Hamel talking right after this one, providing information. This is an area where we can use AI to have the diagnostics that is in par with experts, and have it in the field. In fact, the original paper on this topic was voted as one of the top papers in JAMA for the last many years. So, and a very exciting area which has a big impact. And colonoscopy is another area that we were started in Israel a few years ago, and worked with Sha'arei Tzedek, got some very important progress there, reducing the number of misses in polyps, which could save lives, of course, because when you miss a polyp in a colonoscopy, then this means that this could become later actually develop into a tragic consequences, as we can guess. And what we've seen is that with AI, we can actually help in real time with colonoscopy. The team doing that actually is forming a basis for Verily in Israel. Verily is a life sciences company. It started out as Google Life Sciences, and now it's a sister company to Google. And this is a center, you'll hear more about it from Regev Cohen today. And Verily in Israel is growing and expanding. So this is a very exciting area. So with that, these are all the different areas where we can, and I only touched on some of those different areas. Let me only make final comment here that with all this power of AI comes also great responsibility. And everything that we do here, of course, this is true for all these areas, need to be done with a lot of care about how to do things in a way that does not compromise and preserves totally privacy and security and fairness. Explainability is quite important as well as in this area, and equitability. Each of these areas it deserves its own talk, obviously. And but the most exciting thing is that we are in a position to use AI and technology to make a real transformation in the health system, which has huge economic impact and save many, many lives. Thank you very much.